John McCain is right. If elected, he will get you a $5,000 health care tax credit. He didn't mention if you don't have a family, though, the credit will only be $2,500. He also didn't mention that you'll probably have to give most of that back anyway to pay for the new taxes he'll sock you with if you get health benefits at work, which he'll consider income. He also didn't mention that his plan is so top-heavy, scholars at 4 major universities have concluded that this conversation will be academic for as many as 20 million of you because a McCain presidency would eliminate their health care anyway. Our third story in the countdown, John McCain may be hazardous to your health, as he revealed in last night's debate. As Bob Herbert put it in the New York Times, taxing employer-paid health benefits is the first step in the transition, the equivalent of injecting poison into the system. It's the beginning of the end. Senator Obama's latest TV ad.
John McCain on health care.
I want to give every American a $5,000 refundable tax credit.
Here's the truth.
He says that he's going to give you a $5,000 tax credit. What he doesn't tell you is that he is going to tax your employer-based health care benefits for the first time ever. So what one hand giveth, the other hand taketh away.
John McCain. Instead of fixing health care, he wants to tax it.
I'm Barack Obama, and I approve this message.
Let's bring in the aforementioned Bob Herbert, columnist of the New York Times. Good evening. Welcome.
How are you, Keith?
Obama was succinct there with one hand giveth, the other hand taketh away. Was he being too gracious under the circumstances? Is there a possibility you're not even going to break even with this?
You know, the country won't break even with this. I'm surprised this story hasn't gotten better play, because this is a really radical plan, and I think that if the electorate understood it well, would not be in favor of it. The health care that you get on the job for the first time, you know, it will be taxed under a McCain plan, so that when you look at, just like you see tax for Social Security in your paycheck every week or every month, you'll look in there and there'll be a tax for whatever the value is of your health benefits. Now, he says that, you know, and he's correct, there'll be a $5,000 per family tax offset, a tax credit to help you with your health care. But that study you referred to said because of this McCain plan, an estimated 20 million people will lose employer-covered health care. If you lose your health care and you've got $2,500 a person or $5,000 a family, you will not be able to purchase the equivalent health care. The equivalent health care for a family would cost about $12,000. This is something that is extremely odd to not be a big deal in the course of this campaign.
And we're not talking traumatic stuff, big ticket stuff. We're talking about ordinary health care stuff.
This is the way most Americans get their health care, and most Americans who get health care on the job, they're satisfied with that health care. Yeah. So if you're among the 20 million or so estimated to lose your health care on the job, think about what that would do to your family. That is traumatic.
The infamous article, the contingencies article that John McCain wrote when he wrote an article for the actuarial magazine reader, that we need to do for health insurance what we've done for the banking industry. We'll just for a moment throw out the economic collapse that resulted from doing that, even taking him at his word that he only meant the interstate commerce part of letting you shop for a better health care plan in Arizona if you live in Michigan. Is there any way that won't end in disaster?
No, that will be guaranteed to end in disaster, because what he wants to do is essentially deregulate the healthcare insurance industry. So what happens is a health insurance company sets up in the state that has the least regulations. So what happens now is if you purchase private health care, you may have a plan that says that you get breast examinations that are covered, or you're covered if you have a pre-existing condition, or you're covered for an ordinary annual checkup. Well, if the company is set up in a state that says you don't have to provide that coverage, well, guess what? Do we think that they're going to provide it? No, they're not going to provide it. So you're going to get health care that is of a much lesser value. This is exactly what they want to do, though. I mean, this is an ideological thing. They want health care to go into the marketplace. They don't want health care provided on the job, and they don't want government-sponsored health care. They want everybody out there in the marketplace.
As you point out, not a proven strategy, and Obama has instead individuals and employers shifting to a new national plan. How is that better, succinctly?
Well, it's better in a lot of ways because, one, it expands by a great deal the number of people who would get health care. The big question with that plan is it would be very expensive. If you're going to cover a lot more people with health insurance, you're going to have to pay for it. The government will be on the tab for a lot of that money. And given the environment, there's going to be an awful lot of naysayers who say we're spending so much government money now, you know, guess what, we can't afford to buy health care for people.
Yeah, unfortunately, your options are to do something about it that way, or to do something about it in the way of a self.
In this particular instance, Obama's plan is a much superior plan.
Yeah, it's like comparing it to a self-tonsillectomy kit. Is really what it is. Bob Herbert of the New York Times, thank you for coming in.
Thanks so much, Keith.